Broadcasting live from unceded and unsurrendered Algonquin territory, we bring you another First Nations Health Managers Association COVID-19 town hall. We're really excited to be having an excellent panel of presenters today. Thank you so much for welcoming me into your territories. The group that we have on is broadcasting from their home regions. A couple of housekeeping tips before we jump in. If you happen to have a pause on your video, we encourage you just to hit refresh and then you'll join us back once again. I'm broadcasting live from the crow's nest, little pun there. If you want to ask questions of our esteemed panelists today, a reminder that email is fnhma@ihtoday.ca. We can't make this happen without the team of Indigenous Health Today, at Nation Talk. Of course, I'll come back and do all the thank yous at the end. If you want to join en français, you can do so by dialing in. And Pascal Boulanger, bienvenue. We're excited to have you once again providing the support in French. So let's begin. Grab your tea, grab your bannock and bologna, and settle back and listen on all those radio stations and hear live on ihtoday.ca. We have a number of guests lined up for you, and in order of their discussions, we are so grateful to have the demonstrated and committed leadership. This is Partnership in Action. Hashtag United First Nations Health. AFN, our Assembly of First Nations, has been with us already before. We've had the AFN Youth Council join us, National Chief Perry Bellegarde, and today we're going to keep sharing those information updates. We have Regional Chief Kluani Adamak from the Yukon, who is also the co-chair of the Chiefs Committee on Health. Then we'll move over to Regional Chief Marlene Putra from Alberta. She's a nurse, by the way, so if you do have some questions, I'll direct those over to Regional Chief Putra. And last but certainly not least, we have Regional Chief Kevin Hart from Manitoba as well. And supporting with subject matter expertise and technical advice, once again, is Carol Hopkins from the Thunderbird Partnership Foundation, and also Dr. Brenda Ristool from First Peoples Wellness Circle. Welcome, everybody. And Regional Chief Adamak, you're going to kick us off with the dialogue that we are going to share in this hour. Welcome, Chief Adamak.
Thank you so much. Yake Sutat, that's good morning to all those who are calling in from the West. It's good to see you all. As Marianne mentioned, I am Kluani Adamek, Danche Kluani Adamek Uye, Dachluedi Ayahat, Ageo Hatu Sauk, Kluan Man Kai Iche, Ganach Chish, Algonquin Kwan. My name's Kluani, and I'm from the Killer Whale clan. My Tlingit name is Age, and I'm so grateful to be able to join all of you on this amazing webinar, and really want to acknowledge Marianne, you and your team, all those who have put this together, Nation Talk, Indigenous Health Today, all of those Indigenous radio stations that are tuning in live, APTN, and of course, the health managers and people who are working on the front lines across the country and on the ground. These moments for us to connect have become so different. And certainly as the co-chair of the AFN newly developed task force, as the chair of the AFN Chiefs Committee on Health, it's really important that our people know what it is that we're doing, but certainly to know that we're here to be supportive. And we want to understand what your needs are, what you're going through, so that we're able to support you in the best way that we can. it's it's funny. I was talking to my colleagues this morning, and for those of us who have the privilege to continue to be working right now, I'm, I got ready today. I put on my new Maggie Palace earrings. You can check her out on Instagram. Put on my jewelry. I'm rocking my Heather Callahan from the Yukon cedar bracelet, and took a moment to be grateful. And this is where, in this time that we're in, it's so important to acknowledge where we're at. And it's a moment that, as we adjust to this new rhythm, right? Not necessarily this new world, but this new rhythm that we're all in, and creating and holding space for what we're feeling, right? For the business as usual to continue, while we're also in this space of really needing to experience this great unraveling. What are we feeling? What are we experiencing? And we know, especially for families right now, this is incredibly hard. And so it's so important to um, reflect, to acknowledge where we're at, to recognize that COVID really has magnified a lot of the vulnerabilities and the realities that we know are so real in our communities. Just before we got started, we were listening and talking, regional chiefs and our colleagues, and communities right now who don't have the resources that they need, and communities that don't have access to clean drinking water when we're told to wash our hands, and parents who are expected to continue to make sure kids are learning while they're trying to work from home, or people who have lost their jobs. This is so real, and it's so hard. And so these are the moments where we adjust, we reflect, we acknowledge what's happening, and acknowledge the response that we're seeing happen. And so it's a moment to also be grateful. It's a moment to find ways to be grateful for those small moments. So I had the opportunity to connect with some old friends. That was so special. Want to welcome, in our family, of a new nephew. As of yesterday, his name's Cassius, and he's the cutest little baby. And it's hard, right? Because I won't get to see Cassius. I'm not sure when I'll get to meet him. He's just a baby. But he's born and he's healthy and he's safe. So it's this kind of, how do we continue in this business as usual, but also being mindful of, let's acknowledge the pain and what we're going through, and where are the opportunities and the glimmers of hope. And so when we're talking about the mental wellness and health perspective, it's, we're experiencing that uncertainty. We're experiencing the risk. There's these moments of deep challenge, and it's so hard for everyone. And so then, how do we then respond? And so I had the opportunity last weekend to join this really, really dynamic session, and I encourage you to take a look. Raventree.ca. It's called Active Hope. And what it really is about is a way for us to process this grief we're experiencing, from the grief from the day to day that we're used to, the grief from what we normally are able to do, and how do we respond to this new rhythm. And so seeing the possibilities, seeing the hope, the moments to say, today I went for a walk and that felt really good. Or today, was a hard day. I acknowledge that. And this is what I'm hoping for tomorrow. These are the things that I'm going to look forward to. It's such a new way for us to live. At the same time, it's such an important reminder. And I think about some friends that I have, one in particular who lives in Teslin in the Yukon. And she's like, you know what? This is how we used to do things, though. Right? There would be months and months where you might not see people because you're out on the land living, right, with your grandparents on the trap line, and you'd go and you'd trade and you'd meet and you'd connect, and then you'd go back to do what you needed to do. So it's also being reminded of the resilience that our people have always had, and that if anyone is going to be able to get through this, it's Indigenous peoples, because of the teachings, the spirituality, the connectedness that we have, and the way that we continue to do that in this new rhythm. So I wanted to just really share from a personal perspective, that I know and feel how hard it is. And, want people to know that from the Assembly of First Nations, as regional chiefs, as a national executive, that we're with you. We feel it too. And these are the moments to say, where is that glimmer of hope? And to encourage us all to take a breath, and maybe we can do that together. This is, maybe getting into the yoga space, which some of my colleagues might laugh about. I do like doing yoga. But if we just take a breath in, and breathe out. And it feels so good to just do that once in a while. So with that, I encourage all of us to recognize the struggle is different for all of us, that we're experiencing all of this in our own way. And we've never been through something like this before. And so let's be gentle with ourselves. Let's be gentle with others, and know that how we care for ourselves is how we care for our community and for our people. So looking after ourselves and our families and the ones closest to us right now is so important, because then we'll be able to continue to look after all those who need us most. So with that, I want to say Gynach Chish. I want to continue to offer support, want to really look to our young people to continue to give us the energy, the powwow dancers and the dancers that are sharing live every day. There's a new young person sharing their pride of connection to culture, and that's so grounding. So thank you for that, and look forward to hearing from my esteemed colleagues, Regional Chief Poitras, who is a nurse, right? It's amazing. And Regional Chief Hart, who has been doing work in emergency management for a long time. And these are the moments where we continue to show up together. And to you, Marian, for your ongoing leadership in this work, all of the health managers out there and those who are listening, thank you for joining in this moment of connection, because connection isn't always a physical connection. Connection is the way that we talk and trust and feel. And so thank you so much for the invitation to join you.
Thank you so much, Chief Adamek. We really appreciate hearing your words of hope, reminding us to be on the land, of course, resilience. I really appreciate the passion that you bring in your leadership. And of course, the shout out to the gorgeous earrings. Very beautiful.
And my brace.
Oh, there we go. And you can check those out on Instagram later. Thank you again. And so now we're going to, as Chief Adamek mentioned, we have a nurse among our regional chiefs who have joined us today. No stranger to the First Nations Health Managers Association. Chief Petra, Marlene, you have actually come out to one of our conferences before. You are a nurse and you represent your territory in Alberta. Welcome to the First Nations Health Managers Association COVID-19 Town Hall. Welcome, Chief.
Yeah.
So there we go. Welcome.
Nigan, utawinaw na naskamaw na skisagaw saminaw migoyak. And I'm so grateful for our Creator and for the opportunities that He presents to us. And I thank you very much for the invitation to join you here today. I myself, like other leaders, and I'm sure people everywhere, this has been really taxing on me, like mentally, emotionally, physically, spiritually. And so, in terms of dealing with my stuff, like I always consciously check what's going on within me. Like if I'm starting to feel, slide into that depression a little bit, it's just like, okay, I have to get myself out. I'll go for a walk, or what do I do? And I think, really checking in all the time, constantly is so vital to our survival and moving forward, because it's this is the first time in our time that we have to deal with a pandemic of this nature. Our people have dealt with it, our ancestors have dealt with it before, and so we have that strength behind us, we have that knowledge, and we have that wisdom, and to me that's so important connect to that. Like some little things I'll do is, I'll go outside, I'll go for a walk, I'll go and sit in front of my house, look at this tree that's just starting to bud new leaves, and go for a walk to hear the birds sing, and go hug a tree, just something. Go and put tobacco down and say a prayer and thank the Creator for this day and to pray for our people. Those things are so vital for me, as an individual and for my mental well-being. So those things I practice, all the time. But I understand as well that, the longer that we're in this pandemic, the larger effect it'll have on our lives. Community and culture are everything to us. It's even harder to cope with this crisis when we can't come together to practice our traditions and ceremonies the way we used to. But our people have faced and overcome many grave challenges in the past, and will do so again. Our resiliency, our ingenuity, and innovation will once again guide us through this. I really believe that. I pray all the time and ask the Creator to guide me in my daily work, and I really believe that we have that behind us, and that it will get us through this. I want to acknowledge as well that our people on the ground are dealing with so many stressors. I mean, we're talking about mental health here, right now. They're in crowded living conditions, and which it makes it harder to practice physical distancing. There's a lack of resources for urban First Nations, or some confusion as to where they can access services. So a lot of them are going hungry, and there's lots of needs, and there's lack of adequate resources for our First Nations businesses to thrive and to plan for the future. I mean, they're the economic engine of our communities, and in a lot of ways, provide good economy to Canadians in general. There's racism, there's the deaths of our First Nations that are occurring with little or no justice, and that list just goes on and on and on, and it's really hard for our leaders to try to wrap their head around all these issues and deal with them in a cohesive and effective way. But looking after each other is so key, but first and foremost, it's important to remember that our people have always valued and known how to take care of ourselves and each other, especially during times of hardship and suffering. We have that, like in my community where I come from, in Port Chippewa, Northern Alberta. Currently there is a death in the community of a very good friend of mine, and but nobody can come together for a funeral, and it really hurts our people when we can't practice the customs that we practice all the time. So it's really difficult. But in my recent conversations with government officials, I often say that we'll only get through this pandemic if everyone and every community is well supported to prevent the spread of the virus. And in terms of providing some recommendations to Indigenous Services Canada and First Nations Inuit Health Branch in the region, I've said that I'd like to hear from our spiritual and ceremonial leaders to tell us how we can maintain our ceremonies at this time. Ceremonies which are very critical to not only our survival, but for Mother Earth and the rest of humanity. Our elders and our people, they pray for everybody. They pray for humanity and everybody everywhere. The decision makers must understand the importance of that, and work with our leaders and our spiritual elders, around to develop protocols around how do we deal with funerals? We have to tackle this mental health issue head on. I mean, those are very real. that are happening in our community. So, how do we deal with our ceremonies? Sundances are coming up pretty soon, and how do we maintain those? Because which are very critical to, like I'm a sundancer. I sundance for 10 years, and I always look forward to that because it grounds me and it helps me through the year. So, those things are very, very important to me. And as our people, we've always come together to pray, to sing, to dance, to feast, and just to connect with one another. So it's critical that those protocols are developed, but we'll need the guidance of our ceremonial elders and our spiritual leaders on how we can continue with those practices and in a safe manner. But those are key. I've heard a lot of lately about doing things virtually or by telephone, but we must be cognizant that a lot of our people do not have the luxury of having technology, of having computers, or even having internet services for that matter. So we have to find ways. We have to find ways to reach out to those individuals, and especially those that are dealing with their loved ones that are alone and in isolation. It's critical that we work together to maintain the mental health of our people so we can survive these tumultuous times. We're all in this together, every one of us, and it doesn't matter, the color of your skin. We're all in this together, and we all have to work together, to bring some sanity back to Canada. Everyone says, I can't wait till things get back to normal. There's a part of me that says, normal didn't do us justice. The normal meant injustices for our people. It meant underinvestment of our people. It meant the exploiting of our lands and our communities without our consent and without our involvement. So to me, I believe that we now have an opportunity. This opportunity is to work together to make things better for our communities, and to develop our plans, to develop our laws, to develop whatever it is that we need in place to ensure that we have the resources so our people can benefit and our people can thrive. And the only way that's going to happen is if our treaty partners come to the table and we work together effectively and efficiently. So again, thank you for the opportunity. Hi, nanaskum nawal.
Thank you so much, Chief Petra. We really appreciate your words around staying connected and not forgetting to be grounded in our spiritual and emotional wellness, and reconnecting with those wisdom keepers and elders, and just that sense of rootedness. And thank you. I heartfelt words from you. So just a reminder before we go to our next panelist, that if you do have questions of our panelists today, please go to FNHMA at ihtoday.ca, where you can get your question in. I also just want to give a quick update on our stats. As of yesterday, Indigenous Services Canada was reporting 129 COVID positive in First Nation communities, and that is in Quebec, Ontario, Saskatchewan, BC, and Alberta. So hearts be with all of those nations as they manage this difficult time. Regional Chief Hart, I know you have the emergency management portfolio at the Assembly of First Nations. You're a first-time guest to the FNHMA Town Hall, and we welcome you. Thank you for joining us, Chief Hart.
Good afternoon, everybody, and thank you again for the invitation to talk about a very important matter facing many, many First Nation people, and at this time, globally, us as human beings. Hi, Marion, can you hear me? So, in speaking, and I want to thank everybody. Tansin tutemak pego patagose Indigenous Maswa and tutem. It's a good morning here. I'm on the Saugeen First Nation, and I'm talking to you as the regional chief from Manitoba who holds a national portfolio for emergency management. As you know, you can see right now what's occurring right across this country, internationally, as well as nationally, is that globally, is that we're currently in a pandemic that's affecting all of humanity. That being said, for the 634 First Nations that we have here in Canada, if you look at coast to coast to coast, it's affecting everybody on insurmountable scale. If you look at it across the country, for example, when we start in BC, right now, what's currently affecting our people is not only the positive cases of COVID-19, and of course, our prayers are going out to one of the latest people who is deceased from COVID-19, and that's one of the elders in northern BC, as well as our First Nation brothers and sisters. Unfortunately, some of them have been incarcerated for whatever reason. But however, we're finding confirmed cases that are affecting and resulting in deaths, of course, of our First Nation people. And of course, our prayers are going out to our relatives out there in BC during this time and during this pandemic, and working with our colleagues across the country, as well as the chiefs from the respected First Nations. You see what's happening here in respect to states of emergencies being called from BC all the way to the Atlantic right now. And, we look at the Yukon, we also look at the Northwest Territories with the positive cases, as well as what the leadership are doing there on the ground. From the emergency management standpoint, obviously our first instinct is the safety of our citizens, first and foremost, working with chiefs, grand chiefs, and everybody from each of the respected regions. Obviously, gowns, masks, PPE, as well as hand sanitizers, one of the fundamental things that's in global demand. It's in short supply. You see planes coming each and every day from China and elsewhere globally to bring in supplies here to Health Canada, as well as Canada as a whole. And for us, we've been making sure to advocate for the First Nations in this case to adequately ensure that we have sustained funding to address the COVID-19 concerns and the issues presently faced by First Nations on the ground. As you know, we have many First Nations that are remote, as well as northern communities across the country that are facing every day-to-day challenges. As you know, we have many drinking water advisories across the country. As my colleagues have indicated, when we even talk about having clean drinking water, let alone having water to properly wash our hands and to sanitize and such. So these are things that we continue to advocate for our First Nations out there each and every day. Uh, on top of those things, we're seeing food security is indeed going to be becoming an issue, both on the First Nation and in urban centers. On the urban center side, we're seeing demands in food security when it comes to our most impoverished people. A number of people live paycheck to paycheck. What we're seeing right now is food banks are increasing in demand of 60% across the country, and that this is having a further impact on people when it comes to food security and families more so. Our kids that are not being in school right now, presently the breakfast programs and those lunch programs are being affected. So, our kids are indeed, some of them facing a food security issue. First Nations and leadership are trying to address the problems as they come along. Again, it goes to advocating to ensure that our First Nations have the adequate resources during these emergency events, and when we have a pandemic that we presently have here in the country, that we're properly resourced as well too. As you know, many of our First Nations, when we look at this global pandemic that's happening right now, a lot of us, when we talk about having even emergency preparedness plans, let alone having a pandemic plan of this magnitude facing us, resources are needed from the federal government, and I'm working with my colleagues at the national executive, including the national chief, to ensure that our First Nations are adequately resourced in this time. That being said, there's a lot of off-reserve members that are being affected during this time that we're advocating for more resources. We need more resources for First Nations in order to address the off-reserve situation that's currently happening right now. We know that in First Nations, for example, here in Saugeen, they've been making food packs and such for the community, and I know that yesterday they donated over 800 meat packs to the First Nations here in the households here in the First Nation itself. Now, when we talk about the off-reserve members, I hear from the chiefs, not only from my region, respectfully, but across the country, when they talk about servicing and providing supplies and needs for the off-reserve members, because as you know, Winnipeg right now, we have one of the largest segment populations of Indigenous people in the country, upwards of 100,000 people in the city of Winnipeg. 75,000 of those people could easily be First Nation members coming from outlying communities, both in the province and abroad here in Canada. Food banks are being stretched to the limit, as I said. We're seeing on the social side that, things are occurring. Of course, the social side, when we talk about mental wellness and that, we are still in an opioid crisis that's facing our people out there each and every day. We have a homelessness situation that's affecting our communities in a large way. And when we look at that, we obviously don't want our people to fall through those essential skills gaps and essential needs gaps, because we're seeing that our people, especially the homeless, are being turned away because homeless shelters have to shut down because of protection, of course, of the public. Where do they go? We need to have those answers addressed by the federal government, working in partnership with leadership, both in each region respectfully, working with our Grand Chiefs, working with our chiefs, and ensuring to respect the jurisdiction and the sovereignty of each individual First Nation as they go forward in order to protect their citizens. You see a lot of them restricting access to their First Nation here in Manitoba. They're restricting access north of 53, the north of the 53rd parallel, which means basically the northern part of Manitoba. I encourage that, I support that in order for the protection of not only First Nation citizens, but everybody as a whole, because we're all in this together as human beings as we go along in this battle to flatten the curve when it comes to COVID-19. Some of the things we've done at the Assembly of First Nation is obviously there's been a lot of work by the national chief and ourselves as the executive. That being said, I want to lift up Regional Chief Adamek, Regional Chief Poitras, as well as Regional Chief Augustine, who co-chaired this COVID-19 task force that we established at the Assembly of First Nation. This task force was established just to make sure that we support the 634 First Nations across this country in order to make sure that we do due diligence and get the expertise that we need as First Nations, using our experts on the ground who also have those life experiences that each of us as First Nations live each and every day. Us as chiefs and regional chiefs, we live right here in our First Nations. As you know, I'm a res boy just like everybody else. I was bragging and showing Marion and everybody this morning. I had bannock there, and I had a bannock and egg sandwich this morning. And, just like everybody else out there, we see the frustration of having to stay home, flattening this curve. But I'm telling you, brothers and sisters out there, we have to do this to protect, our most precious resource, our children, and to make sure that we protect our knowledge keepers itself, because we do not want to make sure, we don't want our kukums, we don't want our mushums to get sick. We don't want our aunties and uncles to get sick if one of us as a young person goes out and say we attend a gathering or a party or something and somebody gets sick and they take that home. As you know, we have a housing crisis, we have a water crisis, we have an ongoing infrastructure crisis as First Nations in this country. And that all compounds with COVID-19, for example. We have somewhere of 15 people living in a 3-bedroom home. If one person gets sick, surely everybody in that household is going to get sick. And that includes your mother and your father, your brothers and sisters. So that's why it's so imperative that we stay home, that we socially isolate and social distance, and that we listen to the elected leadership and as well as the health experts out there. So with everybody, I send out my prayers to all of you during this time. Stay strong. We're all in this together. We can flatten this curve, and it'll be no time before we're out there at those ceremonies, at those powwows, and at those social gatherings again, and that we're out there, being one as a nation and one as a family. So take care, everybody. Hi, hi.
Chief Hart, words of inspiration and heartfelt. We can definitely see your commitment to the files that you have, to your nations, and thanks for reminding us of the work that the Assembly of First Nations is doing, continues to do among this landscape around advocacy for all of our nations. A good reminder too for those health directors and managers who are watching, pandemic plans is imperative. If you don't have one, FNHMA will post one on our website next week so that you can have a list and checklists and tools to support you in your pandemic planning at this time as well, especially when we're thinking about the preparation of what people are talking about in terms of a second wave. We're all in this together, as every single one of the regional chiefs on our panel have said. And I think that's a message that's really hitting home, is how do we protect our cookums, our mushums, and all of the loved ones that we have as families. So I really appreciate the reminders of that. So just another reminder then that if you do have a question for any one of the regional chiefs, they do have subject matter expertise supporting them, and no stranger to this town hall is Carol Hopkins and Dr. Brenda Restool. So feel free to send those in to fnhma@ihtoday.ca. Hey, I'm seeing so many people join on the FNHMA Facebook, and we appreciate that everybody is watching and is participating in this important dialogue. Roxanne Sapier over in Chebeak in Nova Scotia, Yvonne, Cheryl, our FNHMA Board of Director for Atlantic, Darlene, watching from member 2 as well. Thank you for all of the support and shout outs there. I'm going to actually now go over to our inbox and hear what some of our listeners and our viewers have for questions for our panelists. And so, Chief Hart, I think this will be one that you can elaborate on. And you touched a little bit already when you were chatting with our viewers and listeners. And it's a question that talks about, is there forward thinking about the food security this fall and winter, especially in light of some of the broken supply chains that we're seeing now among this crisis. And the person emailing in also mentions a healthy diet is key to good health. Are you and your colleagues able to look this far out and then start to implement solutions? And Chief Hart, I think maybe if you want to take that question, I'll pass that over to you. Thank you.
Yes, thank you for that question. And as you know, right now, what we're seeing during this pandemic time is, for example, in the Northwest Territories, they utilize some funding in order to go back out there on the land to address that issue where they went back to do traditional hunting and that. You're seeing that happening and occurring in our other respected regions where our traditional hunters and such are going out onto the land. A lot of them, before the ice breakup and such, that they're setting nets and that out there as well too to get fish and sustenance, not only for the elders, especially in their respected nations, but for the people as well. On the other side, when we talk about food security, I know that the national chief initially, when we started talking about the state of emergency as an executive at the Assembly of First Nation, he reached out to the Prime Minister to ensure that the northern food stores would not increase prices. As you know, we pay some of the highest prices when it comes to food across this country, especially in our northern and our remote communities. So this is something that we're going to definitely monitor, given the recent shutdown of the cargo plant in Alberta as well as the other plant. This is going to have a direct effect when it comes to meat, as well as the meat supply, not only here nationally, but as well as for First Nations across this country. I've seen a number of First Nations work with other communities, for example, the Mennonite communities and such out there, where they've used them to address the food security issue in terms of meat and produce and poultry and such. Eggs, for example, where they're reaching out to those communities as well as the Hutterite communities and such. So you could see that we're working amongst each other as human beings, and we're reaching out to everyone. For example, I know for myself, on the emergency management side, I've reached out to people and I've been identified with colleagues and such, like, for example, Cisco International, who works regularly with just restaurants per se. They are having direct relationships with First Nations in order to address that food security issue directly. And I know that First Nations and chief and councils have direct relationships and business relationships with suppliers and that. So they're addressing that issue wholeheartedly and as well as headstrong with the individual suppliers as they come. But we all know that there is going to be a food shortage in the next month or two with the Cargill meat plant being shut down. So we're working with both federal, provincial governments, as well as all bodies with chief and councils to ensure that we address this in a timely manner.
Thank you for taking the question, Chief Hart. Much appreciated to have your perspective and lens on that. Regional Chief Petra, this is something I'm going to call on your nursing expertise to possibly take a crack at this question. And we have a couple of minutes left for Q&A. So Chief Petra, there's a couple of points in the inbox around people living in remote communities who have comorbidities and significant issues and the ability to self-isolate. Are you aware of specific protocols for how to address the self-isolation? And, what are your thoughts on moving these folks out before they become critically ill? So, Chief Petra, over to you with your nursing background.
Thank you, Marian. I think that's critical. I mean, I mentioned that we have overcrowded housing conditions, and I know that a lot of the nations are repurposing schools and different places like that. And I come from a community of Fort Chipewyan, which is remote, and it's a fly in and fly out because the excuse me, Winter Road isn't open, it's closed, obviously. So, that always poses a challenge, but especially with the Fort McMurray Hospital, for example, transporting their elderly to other hospitals like in Lac La Biche and other towns, right? So it does pose a challenge, and it's a stressor, but I believe that the leadership and the frontline workers and the nursing personnel in those communities are doing an exceptional job in responding to those crisis situations as they arise.
Thank you, Marlene. I really appreciate the reminder about the recognition to all of those health professionals who are managing our front lines, and we hold them high. So I'm going to go over to Chief Adamak. Kluani, we know that you are the co-chair of the Chiefs Committee on Health. What are some of the dialogues that you're having at those tables? And is there any significant themes or concern coming from that you don't see being addressed? So over to you, Kluani. Thank you.
Thank you. And, certainly we are meeting every week. And so for those on the line who may not be aware, the Chiefs Committee on Health includes a Chiefs representative from each of the 10 regions. We also have Youth Council participation from the APTN National Youth Council. And that also includes, of course, our welcomed traditional knowledge keepers and the Women's Council representatives. If they choose to join, then we're always welcoming them as well. The Chiefs Committee on Health, and we've been meeting every week since, I will say, the beginning, right? And so we're talking really about, that second week of March when this new rhythm, right, that we're all living in really shifted. There's a lot of priorities, and one of the pieces that is starting to arise, and this links really strongly with the work of the Chiefs Committee on Emergency Management, is the planning. So, what is it going to look like when provinces and territories are removing some of these restrictions? What does that then mean for our communities? And recognizing from a rights-based approach, we've seen communities across the country, having security access points, shutting communities down to people who weren't citizens or members of those nations, for example. So there are going to be some really important conversations about those steps. And from a planning perspective, how will First Nations continue to lead with respect to advancing the solutions that are going to work for them? Weekly, there are always, issues and questions in relation to access to PPE, right? So the protective equipment, as Regional Chief Hart mentioned, food security, right? A lot of our remote and isolated communities are incredibly limited in terms of the supplies that are regularly there. And I often make that kind of, that reflection that in a lot of urban centers, right, at the beginning, everyone's like, there's no toilet paper, or there's not, lettuce. And it's like, these are things that our people are dealing with every day. So it's being mindful of that to say, our communities continue to be so resilient in the midst of what we know is the biggest impact internationally that we probably deal with in our lifetime. And so it's about the planning. It's about making sure that we're taking all of those moments and things we've learned. So access to equipment and supplies, ensuring that communities, as Regional Chief Poitras mentioned, a lot of spaces are being repurposed. But when we look at the infrastructure needs in communities, again, as I mentioned, COVID really has taken like a magnifying glass and said all the vulnerabilities that we know are already real, all the inequities that exist across our communities have been magnified by COVID. So we really need to be taking the approach of equity. We're hearing that from across the country, that we'll continue to fight and advocate for our communities to have the same access to what humans need that everybody else has. So that's where there's a lot of learning. There's a lot of sharing. There's a lot of realities. And of course, we know how vulnerable our communities are if and when COVID does hit those communities. And I really want to, and I acknowledge Regional Chief Hart and Poitras for the strong messages that they shared, and acknowledging those communities that are dealing with COVID in their community right now. And certainly we know that there needs to be more services, there needs to be more support. And, this is such an important moment for us to take what we're learning together. And how are we going to create and support change for this new rhythm that will be post-COVID? Because life's going to be different. The life that we knew is going to be different, and that's okay. How do we want to then influence and change and create even stronger communities moving post-COVID? And that really becomes, the work of the task force, the work of the Chiefs Committee on Health, the work of the Chiefs Committee on Emergency Management, the work of all the people across the country, the heavy lifters. It's the people who are doing water delivery, like my dad, to the people who are teaching and trying to help kids, to, the people on the national executive who are working hard to make sure that at every moment we have an opportunity to address these issues with our federal or provincial or territorial colleagues, that we're able to do so. So those are the things I hope that helps to share, on top of, right, the mental wellness, on top of, as mentioned, the housing issues. Every single vulnerability and issue that we know existed and have felt in our own communities has been magnified through COVID. So this becomes that moment of glimmer of hope, that moment of opportunity to say, what are our communities going to look like after COVID? And what are our expectations? And what do we want to create out of all of this? So those are the reflections that we continue to hear. And so looking forward to, as mentioned, our colleagues who are here, Regional Chief Poitras, Regional Chief Hart, members of the National Executive, the Youth Council, our knowledge keepers, to work together to say, this is where we can work together to support First Nations in their solutions.
Thank you, Chief Adamak. It's always wonderful to hear the role that you each play in advocating and ensuring our voices are heard at the Assembly of First Nations with your partners, to hear about the task force that is being put together with all of the subject matter experts that are required around those tables. We can't thank you enough. As health directors, as health managers, health professionals, we look to you for the governance and support, and you're not letting us down. Thank you. Really appreciate that. Just in terms of a couple of questions that have come in from the inbox, and I'm cognizant of time as well, I do want to share, there's a number of questions that people are saying, I'm overwhelmed with the information that's coming out. There's too much. Where do we find all of the tools and supports? And I'm going to shine a light on Indigenous Health Today right now. As part of the First Nations Health Managers Association Info Point, which is a helpful desk that will be opening up on Monday. We want to navigate health directors and health managers. If you don't have time to dig for that material, feel free to give us a call starting Monday in English and in French from 8 o'clock to 8 o'clock Eastern Daylight Time. In doing so, we realized that a number of organizations are gathering information, COVID-19 resources specifically, and to break down the silos, we asked Indigenous Health Today if they would support us with the information management. So you will see that we'll start directing traffic on Monday to Indigenous Health Today, where we will be posting all of the relevant information, updates, and discussions that are happening around COVID-19. So Dawn over at Nation Talk, thank you for agreeing to be a partner with FNHMA in this great undertaking. You have made the commitment that this will be done in a regional fashion as well. So Indigenous Services Canada, when they send out that communique to all of the folks in, say, Saskatchewan, they can go to ihtoday.ca, click Saskatchewan, and you'll see those resources and information being shared there. So I really appreciate all of that and those efforts. Um, I think what I'm going to do now is kind of go into some thank yous and what's up for next week. Uh, the inbox will continue to be open. So again, feel free to continue the dialogue. Ask the questions that you want posed on this very public forum. That's why we're here. And once again, that is FNHMA at ihtoday.ca. Coming up next week, we want to share with you the words of some other national Indigenous organizations who are battling the front lines very directly. We're going to welcome Leah Bill, the president of the Canadian Indigenous Nurses Association. We're also welcoming Dr. Nell Wyman from the Indigenous Physicians Association of Canada. And don't forget, for all of you policy wonks who love data, and I know there's a lot of you, we have asked that Bonnie Healy from the First Nation Information Governance Center join us as well to talk about how do we find the data? How do we use the Regional Health Survey? It's our data made for us, by us, and we want to profile and shine the light on those organizations who are also part of the hashtag First Nations Health United. So stay tuned next week to welcome those speakers to the FNHMA Town Hall. There are a number of avenues that you can hear our message. One, feel free to go to the ihtoday.ca website to see former town halls. We've had a number of wonderful speakers, information being shared, especially by Carol and Brenda. Thank you, ladies, for the words of encouragement around cultural supports, the reminders of mental wellness, and the words on addictions. We can't thank you enough for being those strong partners and sharing those messages. APTN, thank you for making sure that this is broadcast on the APTN News Facebook. We also are seeing this on the FNHMA Facebook page. And listeners, we've got listeners from the Wolf 95.7 in Fredericton, Eagle Feather News, Saskatchewan, NCI FM Radio in Manitoba. You host me every Thursday morning live at 6:30 in the morning for your listeners to talk about the panel that's coming up. So thank you so much for your support in ensuring we're getting the COVID-19 messages out to the Manitoba listeners of NCI. CFWE FM in Alberta, MBC Radio Network in Saskatchewan, my home territory, Treaty 4, Pawpaw First Nation. Little shout out there to the folks there. CJWE FM in Alberta, ELM and TFM in Toronto and Ottawa, Alberta Native News in Alberta, Micmac Maliseed Native News in Atlantic Canada, the Co-op Radio in Vancouver, their affiliated Facebook pages as well, and Carrying Live is also happening on NCI. So hey again, NCI listeners, and rebroadcast on radio 3 o'clock Thursdays on MBC, CKLB on Thursdays at 4, Co-op Radio Thursdays at 5, and the Wolf 95.7 Sundays at 9 a.m. Atlantic Daylight Time. That concludes another town hall brought to you by the First Nations Health Managers Association. Thank you very much to Dawn and the team at Nation Talk, Stella, Chris, we thank you as well. Brenda, Carol, I know you didn't get a chance to speak today and you were here to support our regional chiefs. Regional Chief Kluani, Regional Chief Marlene, Regional Chief Kevin, Keep up the outstanding leadership and commitment. I would be remiss to not thank TELUS for providing all of the dedicated phone lines, and of course, the FNHMA family and board of directors who wish you well. Stay healthy, stay safe, and see you next week. Hi, hi.